Good afternoon, everyone, and welcome to the seminar, this afternoon's seminar. Welcome from the Bevan Commission. Apologies, my chairman and director really is unwell at the moment and is in hospital. So Samantha Aylward has sent his apologies. But I'd like to extend a huge welcome, and we're delighted to be doing this seminar in partnership with the Society of Occupational Medicine. I'm not going to attempt to introduce you all. We would be here until for the 2 hours. We received over 450 applications in the first 36 hours to attend this. And all I can say is a massive welcome to you all. We've got people from inside the UK, outside of the UK. We've got large companies, small companies. We've got the standard services, the NHS, fire, police, and so on. We've got the universities, we've got aviation, ports and railways, retail, manufacturing, you name it. We've got representatives from across the board. But we are delighted to have you all here today. I'm just hoping that you can hear me. If you give a finger up, just a thumbs up, just to let me know that you're fantastic. That's lovely. That's all I need to know. I'm just introducing and setting the scene really, and I'll hand over. But just to really give you a little bit of a context for this, the Bevan Commission is the leading think tank for health and care in Wales, and it looks at and analyses in an independent way, drawing from the expertise of its 23 commissioners. We draw these from not only in Wales, but outside of Wales, all over the UK, but also from abroad. So we really are independent. And we also provide advice not only inside of Wales, but outside of Wales. We have a number of commissioners who are have very strong links with occupational health. And in particular, our chairman, Professor Samantha Aylward, was in fact he was the Chief Medical Officer at the Department of Work and Pensions for many years. We also have Professor Ewan MacDonald, who's one of our commissioners, and you will hear from him later. But we also have others with an interest, such as Dame Carol Black, Sir Anthony Newman-Taylor, and Lieutenant General Louis Lillywhite, from who's the retired Surgeon General of the Armed Forces. So we have really key people who have a real genuine interest in ensuring that the workforce is well and the workforce is maintained as being well. We recognise the significance of work and health, and in particular of the relationship between good work and health, and ensuring that we have and maintain not only some of the more traditional chronic conditions with which people live, but also the evolution of issues such as stress and happiness and satisfaction that we are seeing evolving on workplaces at the moment. It's very clear from seeing the huge amounts of names here that we're all in this together. COVID presents even more significant challenges. Some of these that we can anticipate, many we can't. We're also seeing different countries take slightly different approaches. And here in Wales, we have a different approach. We are still in lockdown as we have been for the past weeks. So we will learn and watch from England and from other countries as this evolves. And I think it's fair to say that no one person or organisation or individual has all the answers. And that is why I think it's really important for us to have this opportunity today to be able to preempt and look at, if you like, in advance of the launch, the toolkit that's been put together by experts. But for us to listen to the experts, but also have the opportunity at the end of the session to be able to ask questions and to share some of the concerns and some of the solutions. So with no further ado, I'm going to hand over to Nick, the Chief Exec of the Society for Occupational Medicine, and he's going to chair the session, and I'll revisit at the end. But as I say, hopefully you'll get to know the system. You can ask questions through the chat mechanism. We've asked you all to turn off your mics so that there's very little disturbance as and when the speakers are speaking. So Nick, I'm going to hand over to you now.
Should I take this? Okay, am I live?
Yes, you are.
Fine. Okay, I've got the honour now of introducing the sessions. Best practice for returning to work for what will become a new normal. Something that's going to be challenging for many of us, if not all of us. Next slide, please. Okay, so best practice, what are we talking about? Life has changed considerably and rapidly over the last few months in a way which would be totally unanticipated even 6 months ago. Lockdown has been a necessity to remain safe. For some people, this has been extremely difficult to cope with, impacting negatively on the health, safety and welfare of so many people. Businesses have taken a huge hit. Some are no longer viable. Some are going through the stages of thinking we might not be viable. And certainly people I've been speaking to have been telling me that there is a likelihood that their jobs will definitely go and that they will be made redundant. So where are we now? Easing of lockdown is now a reality. We'll be returning to work, but for many this will not be a workplace with which they are familiar. And this can be extremely challenging for both the employees, particularly those that have got anxieties, and also their managers. So it requires some careful planning. We're facing what is going to be called a new normal. Life, and the workplace in particular, will not be as we have come to know it in the past. By planning for the final return to work, that means that you're more likely to be successful in that. Next slide, please. So how is the best way to plan that return? Well, using a risk assessment approach is a very good way forward, because that will allow you to ensure that strategies are put in place so that the workplace and how work is carried out does not put people's physical or psychological health at further risk. When people return to work, there'll be a lot of anxiety. And to be aware of that is so important. Thinking that it's not just physical health, it's mental health as well. And that might be one of the biggest challenges when people return. So planning that return requires a multifaceted approach. And some have produced a toolkit which can help businesses to prepare their route map for what they manage and how they can sustain this return to work. Next slide, please. So what's the panel today going to discuss? Well, I'm really looking forward to a number of these. The first one's going to be return to work, looking at the evidence, and that's going to be delivered by Professor Ewan MacDonald from the University of Glasgow. He's a very experienced occupational physician who's highly regarded. A responsible business approach, and that's going to be led by Susan Raftery, who's a senior advisor from ACAS. Then an important part of this jigsaw, as well as occupational health, is going to be the role of HR in that return. And Rachel Suff, who's a policy advisor at the CIPD, will be taking the lead on that session. And finally, a big issue that we're all going to face are mental health issues. And that will be undertaken by Christine Poulter, who is a SOM strategic clinical advisor. And finally, it will be followed by a question and answer session. So at this stage, it's my absolute pleasure to pass over to Professor Ewan MacDonald, who will now consider the evidence to be considered by businesses in planning an effective return to work strategy. So over to you, Ewan.
Right, share. Right, we're on screen for beginning that here. Sorry, I'm just needing to go back up, get this right.
Okay. Ewan, I think Lisa's in charge of the slides. I don't think you need to worry about that in terms of sharing.
Really? Oh, yeah. That's okay.
Just say next slide.
All right, okay. Well, listen, thank you very much indeed for the invitation to speak at this, and to be part of this very competent team, impressive team that I'm the privilege of speaking with. So I'm talking about COVID-19 and the return to work, the role of health professionals. And the title's quite important. It's the role of health professionals because it's more than just occupational health professionals, of whom there are not a huge number in the country. And the challenges have already been alluded to by Anne and are considerable. So I'm just going to cover quite a lot of area. Next slide, please. So I'll tell you a little story. Once upon a time, next slide. We would travel to work in the morning. We'd have congestion and pollution. We worked in offices and factories. We would travel to meet at meetings. Our children would go to school. We would shake hands when meeting. Sometimes I'd get a kiss, which would be a pleasure. We were stressed by the hurry, sickness, and pressure at work. And in February 2020, we had 33 million people in employment in the UK, the highest ever, and 1.7 million people working at home, one of the lowest in Europe. And we had the lowest unemployment in British history, 4%. Next slide. So with COVID so far, it's been an explosive impact on all of our lives. How many people have had it? Well, it's supposed to have mortality between 0.5 and 1%. There's supposed to be 32,000 people have died. Now 1%, therefore there must be, if that's the only, that's probably an underestimate. So therefore there's been at least 3.2 million people have had COVID. That learned medical journal, the Daily Mail, on the 28th of April, said it was 4.2. So, and other estimates have suggested it might be 10% of the population of London, but possibly about 5% elsewhere. Now, and this has come upon us very, very quickly, and still a lack of testing and a lack of contact tracing. A lot of the policies as regards working people have been really a spin-off from modelers and epidemiologists. Could you go back, please, to that slide? We should be an ipre-dominated policy, and that probably has given us the issues with lack of PPE initially, and there's also been evidence of a lack of occupational health and safety thinking at the centre. And the clinical advice we've all had so far has really been based on data linkage, which is linking a particular condition with a particular individual. And so that's where we are in relation to the sort of health and occupational health advice. But it's changing every day, and there's a continual flow of, could you go back, please? One slide. Yeah, okay, sorry, the next slide, sorry. Yeah, next slide, that's it. Okay, this, the continual flow of advice, and so the advice is changing all the time. So the return to work issues very quickly. Have you had the infection? If you've had an infection, are there any post-infection problems? Have you had a warning letter or a shielding letter? There's been a lot of misleading publicity. We might be in a black and ethnic minority group. You might have somebody with multiple morbidity. You might be working in a public-facing role. You may have anxiety about the working environment. And certainly, there's a lot of anxiety around with this once in a lifetime pandemic. Next slide. So the impact on mental health, I'm just going to touch on it because it's already been alluded to, and there'll be a very useful presentation later, is the ONS say there's a doubling of anxiety levels. The Mental Health Foundation suggesting that 25 million people are concerned about health, job security, or money, and that 34% of full-time people are worried about losing their jobs. That 20% of the unemployed have had suicidal thoughts, report having suicidal thoughts in the past 2 weeks. And we've got the highest unemployment on record, with 7 million on furlough, and unemployed on top of that, the individuals that haven't been able to access. And we do know that unemployment is dangerous for health. So just one bit of science about this is that there's quite a lot of evidence, objective evidence about the effect of unemployment. And one relatively recent study was North Finland cohort. Men unemployed over 500 days with a shortening of the telomeres. In other words, the DNA change, which shorten every time your cell divides, shorten faster when you're unemployed, particularly men. And already with unemployment, you can see rise in inflammatory markers in the blood within 3 months. So there'll certainly be people in the population, there'll be, as we would expect if we were surveying the whole population, we'd be able to identify evidence of some of these biological changes which are occurring as a result of the situation. Next slide, please. And multimorbidity, so far people have talked about single conditions and advice about single conditions. If you've got particular conditions, you should be shielded and stay at home. The reality is that 33% of the UK population have multiple morbidity, i.e. they have more than one thing, more than one condition. And we're now into aging workers with extending working lives, and 55% of the over 65-year-olds have multiple morbidity, i.e. they have 2 or 3 conditions. So this makes the assessment of risk and people going back to work rather more complicated than it would be if individuals just had one condition. And the shielding letters have been based on single diagnosis, vulnerable groups identified on that basis, partly based on anecdote, and there's not much evidence of occupational health insight embedded in the agencies which are advising us. So for that reason, next slide, please. For that reason, the Society of Occupational Medicine has sponsored quite a lot of initiatives, including this one, supported by the faculty, that set up an occupational health support group 6 weeks ago, which I chair. That led to a PPE advisory group chaired by Rob Aitken of the IOM, which has helped to drive changes in the standards provided. There's also a multi-agency, multidisciplinary return to work group, which is part of. And within it, we've got a lot of work going on in terms of clinical risk assessment within the SOM extended group, involving ALAMA and using an ALAMA-based website, where we've got an academic group and a practitioner group, and in the last few days have now produced relative risk estimates on various conditions and various states such as age and ethnicity, and developed a concept of COVID age. So that should be in the public domain within the next few days. That work's been done, led by people like Tony Williams, President-elect of ALAMA, but contributed to by academics and practitioners. And that's going to be very, very useful in the next few days. The science is being developed very quickly based on the evidence that's available now, but it's changing all the time. But so this COVID-19 return to work guide is part of the return to work toolkit. It's really for health professionals who are advising patients and employers. Next slide, please. So if the worker's had the infection, most will have made a full recovery, but post-viral fatigue is very common. If they've been unfortunate enough to be hospitalized, then they're much more likely to have residual pulmonary damage, renal damage, physical changes, psychological effect, and assessing fit for work becomes very important. And these individuals will need restrictions, adaptations, and adjustments needed, some of them, to get back to work. So this guideline I'm talking about has been produced by colleagues Drushka Lalo and Muna Roy, both in Glasgow. Muna's the Medical Director of Integral Occupational Health, and myself from Glasgow, but my colleagues have done most of the work, which is my normal tradition. Next slide, please. So why do we need return to work guidance? So there's about 63 million people furloughed at the moment. They're going to be returning to work progressively. Many home workers will be, currently people who are working from home will be returning to work as well. They've had to adapt to the home environment and to get back. Many will be post-COVID-19 infection. And remember, 33% of them already have multiple morbidity. So we've got issues with older workers, people with varying ethnicity, pregnancy, and the other problem we have in the UK, only 50% of all workers have access to occupational health. And that will come back to that, and that's why this guide is being developed. And there's the issues of anxiety and intercurrent illness they've had as a consequence of being off. So most of those returning to work will be seeking advice from their GPs and consultants and therapists and other groups. And this guide is aiming to provide a stepwise approach to assist clinicians understand the process and how to provide advice. Next slide, please. So this inverted pyramid is to demonstrate the stepwise process that's required in terms of advising about return to work in individuals with health conditions or post-COVID. And it's complicated in this situation because it's not just people returning to work after a normal illness, it's also people with vulnerabilities going back to a workplace which may present occupational risk of transmission. Now, the first question that occupational physicians and nurses ask people about is their jobs. They don't tell me about your health problem, which is almost ubiquitous elsewhere. We ask about the work. What is the job? What do you do? What is the environment? What are the risks? So there's a process where that starts, and then there's a clinical assessment and clinical vulnerability risk assessment. That informs an overall occupational health risk assessment. Along with that goes health promotion and the advice we give to the individual. And then there's de-ice, which is the discussion with the employees' ideas, concerns, and expectations. Because remember, the people have got all their anxieties, they've got their social factors and other things to be concerned about. And then they have the recommendation about return to work. So the process is different from the normal clinical process. Next slide, please. So it depends on the nature of the workplace, the type of industry. What about the work organization? Do they have social distancing? Some companies are really very impressive done. Travel, do you travel by public transport or do you travel by your own car or by bike? How do you get in and out of work? Is there availability of PPE? Is there suitable hand hygiene, canteen, social distancing? What about toilets? What about breakout areas? Have you the ability to avoid symptomatic people? Next slide, please. So this is a kind of an extract of the document, just showing the various mapping out for people to see the various areas that are important. They're important for employers, but it's also important for the clinician to know what is the person going back into, what are the likely exposures. Next slide, please. So the medical and clinical vulnerability risk assessment has to cover the issues of the underlying conditions, their history, hospitalizations, what medications are they on? How many times have they been in hospital? For example, asthma and steroids. Are they on immunosuppressants? Have they had chemotherapy? All of these things have to be considered in terms of weighing up the risk of the individual going back to work. Then there's the evaluation of the comorbidities and characteristics. Age is by far the biggest risk factor. Ethnicity, BMI over 40. Are they pregnant? Have they had a shielding letter? What sources of advice have they had? And the COVID age calculation, which will be available to us shortly, will be enormously useful. Next slide. So this is just to illustrate the issue that people coming back to work, they may have had COVID or not had COVID, but they've got all of these other, you can see the number of disorders, clinical conditions, people at various age groups will have. I know this is a very encouraging slide, and many of you of mature age will be very encouraged to see this slide, but this is represents, if you like, clinical challenge. Next slide, please. So again, this is just a chart from the guide, which is a short guide, quick to grasp. Just looking at risk after control measures are implemented. It's about looking at all of these risk factors and deciding whether they're low, standard, medium, and high. And as with all health and safety risk assessments, the highest if one's a standard, the highest one's high, then the whole environment is high risk. If it's medium, then the whole environment is medium risk. The standard sort of safety type thinking. Next slide, please. You must also remember the biopsychosocial factors, the fact that people will have disability, involved with our attitudes and beliefs. It depends if we're distressed or not, how we cope with things. What social factors and problems have they got, which are influencing how they present and how they respond to illness and how they respond to environments. Next slide, please. So, having done the workplace risk assessment and the medical and clinical vulnerability risk assessment, that then determines the overall occupational health risk assessment. Next slide, please. And going beyond that, of course, then we have to deal with the health promotion. Well, what's health promotion to do with this? It's exceedingly important because quite a lot of the risk factors are modifiable. Next slide, please. So diet, physical activity, issues like vitamin D is probably protective. The whole of the UK population should be in vitamin D anyway, because we all tend to be vitamin D deprived. Smoking, alcohol, mental health first aid, emotional resilience. Is there employee counselling available at work? So these are the areas that also need to be addressed. And when coming to discuss the employee's concerns, it's about involving them. Sometimes the person going back to work, there's almost a negotiation between the clinician and the individual about the different perspectives and views in terms of the consensual process of agreeing to what they're able to do and what the recommendations can be. And there's all the issues about the expectations and the adequacy of COVID-19 control measures and workplace safety. Next slide, please. So the return to work advice might vary from people who are shielders or very high of clinical risk, coma only, to people with moderate risk where they might be able to go to work in a socially distanced environment, to start with standard risk with no health conditions or risk factors. But there's always the factor going back into the work. Is the work clinical facing? Is it an area where there's a lot of personal contact and difficult to protect? Do they have any pre-existing risks which make their prognosis if they catch the infection worse, i.e. like age and ethnicity? It's all dependent on employers' maintenance of standards. Next slide, please. Now it's also, but work is not only the traditional work we're thinking about. There's an awful lot of other work goes on in voluntary and education and caring. People running a family are workers as well. And within these contexts, they will sometimes, they need advice too. Next slide, please. So this slide, I think it was from Carol Black, is in our report. Just the issue for us all pre-COVID is to minimize ill health, mitigate its effect on function, and enabling participation in work and extended working lives. And that is what we're all concerned about. Next slide, please. So the role of occupational health and health professionals is about helping people get back to work. It's the process of risk assessment. For COVID, it has to be a multi-layered approach. This guidance is to aim to provide advice to GPs and secondary care and other clinicians so that they understand the issues that are involved in return to work health guidance. Next slide, please. So we know the new paradigm by Waddell and Burton that all the evidence is that work is beneficial. Work is generally good for health and well-being and improves health. Next slide, please. So the risk assessment is important, the risk of transmission, the individual's risk, the rehabilitation, counselling and support, vocational rehabilitation, advising organisations are all the challenge. And the next slide, please, if you would please know, is my last slide, is just to remind us, put this in context, that worklessness is the single most important cause of health inequality, social deprivation and mortality. So we have this balance of helping individuals return to work, often to high risk jobs, but at the same time balancing it, protecting them from adverse effects going back to work, ensuring that if they're if they're unwell or if they have a disability as a consequence of COVID, that the job is modified, enable them to work, and to help them rehabilitate, get back to normal, and extend their working lives. Thank you very much.
Thanks, Ewan. Hopefully you can hear me, is that right? So it's Nick Pahl here. I'm the sort of thread running through this webinar, and a very good presentation there, Ewan. I've had two queries, one on COVID age, and I think Bethan has replied to that on chat and on the chat. And the COVID age are these tables that Dr. Tony Williams has done in terms of the risk. So you might want to just mention about the kind of COVID age work again. And also we've had a query about organisational and individual trauma and how that's dealt with. And I've also replied on chat about how to join these groups. Just to summarise again, there's an overall multidisciplinary group representing organisations, which Som chairs, which also has hygienists, ergonomists, nursing groups, the Royal College of Nursing and others on it. Then we've got subgroups, one on PPE, one on mental health, and one on return to work that produce this work. And then Ewan chairs a strategy group, particularly looking at these COVID age risk assessment tables. Ewan, do you want to have a comment at all on the COVID age query or organisational individual trauma?
Yeah, I think on COVID age, first of all, this is something which I only heard about on Monday, and because the study had just been done, and it stems from the work started off by Tony and his colleagues in terms of looking at the data and creating tables, and that has been developed further by people like David Coggan, Emeritus Professor from the MRC in Southampton, Peter Croft, and Paul Cullen and other academics have looked at these conditions and mortality in a population of 17 million people in general practice, of which there are some data, and looking at their characteristics and the details of their ill health and the details of their illness. And that has led to the development of these tables. Really exciting, potentially exciting, not yet published. It needs to be published very quickly. I think it'll be very useful. We're all familiar with, if you go for a lung function test, you can say, well, your lung function's this, and your relative to age, you might be 35, but you're a smoker, and your lung age is now 45. And we're used to that also in other physiological measurements. So this will be a useful. It's still to be tested, but things are moving extremely fast at the moment, as you'll all realise. Still to be tested and evaluated, and I think it is going to be very useful for the clinician like myself when you're seeing individuals with different characteristics. But it still has to be developed and tested. So, but the concept, I think, is a very good one. First posed by Tony Williams and David Coggan and colleagues.
Yeah, thanks, Ewan. Just I was looking on the chat again, that some people are saying to what extent has there been sort of peer review and validation, and I think those names there show certainly a degree of validation, and we're hoping that work has also be reviewed through the Royal College of Physicians and Academy of Medical Royal Colleges. Certainly the RCP in our meeting that Ewan, Will and I had with them were very keen to take it forward. So obviously it's fast paced, and we need to work to the timelines of return to work rather than necessarily the slower pace of peer review. Here's a question. I'm not sure whether you want to talk about organisational individual trauma, Ewan, but also there's a question from Marjorie Fish about concern about management and return to work. Some employers are believing or misunderstanding herd immunity, which I'm sure is going on out there. Do you want to comment on that?
Yeah, I think herd immunity was raised by, I think, the chief scientist, Sir Patrick Vallance, quite early on, which is the concept that once a lot of people have had the infection, then the immunity slows it down, I think you need about 60% of the population to have had it. But I think that, and herd immunity is a real concept. That's just why when we get the flu epidemic happens every year, it doesn't affect too many of us. But it's rather premature to be thinking about that, I think, in the early days of COVID, because if there was no control measures to reduce the rate of infection and reduce the impact on people, then the healthcare systems would be completely overwhelmed. So ultimately, we'll all have herd immunity. I'm an older worker, and I want to be the first person for the vaccine, please. And once we've all either had it or got the vaccine, then there will be some herd immunity. But the extent to which an infection or a dose of vaccine will protect us in the long term is variable. And as you know, each year vulnerable people have to have a new influenza vaccination. And we may be in the same kind of ball game here.
Okay, thanks, Ian. Here's an interesting question. I have an employee that has a shielding letter but wishes to return to work. What's your thoughts? I've seen there's no specific advice other than advice not to. That's a nice question. What do you think? Well,
it's a very nice question. I'm going to be a bit provocative in answering it, as you might expect. I've also had employees raise queries about having a shielding letter, but they want to go back to work because they feel fine. And this is, and so the shielding letter is based on data linkage. So that's looking at a certain procedure or a certain medication or a certain condition, and or certain medication, and that's been the reason for the shielding letter. I think the shielding letters are advisory. They're advisory. I think clinicians take them very seriously because I certainly have had reason to doubt. This was a person who had a pulmonary problem. 5 years later is perfectly fit and his lung functions far better than normal and feels perfectly normal, and there was no ongoing underlying condition, but it had been come up in a data linkage exercise. So I think there will be exceptions, and there will be people who will want to get back to work. Just as people are over the age of 70, we don't want to stay at home for the rest of their lives. And so I think there will be tensions in the system, and sometimes there will be scope for review.
Yeah, here's a question I bet you can't answer, but maybe we can get back to Sally, which is someone who's worried about what he might inhale from the face mask itself. I imagine that's the one for the occupational hygienist. Do you know anything about that, Ian, actually, in terms of the face contamination from the face mask?
Well, well, face masks generally are of short-term use. The face mask, there's different types of face masks. There's the face mask, such as the surgical paper mask, which will provide probably about 65% protection from infections, maybe up to 80. And there's the face mask, which is the FFP3 or equivalent, or N95, and they'll provide, if worn properly and tightly, they'll provide 95% protection and reduction of risk of infection. These masks are really for one use only, in an ideal world, or one day only. If someone's, then there's advice has been given, certainly by the PPE group of the Society, chaired by Rob Aitken from the IOM, and I support it, where people out in public should wear face covering. And certainly there's evidence, the WHO have said there's evidence if you wear everyone's wearing a face covering, that it tends to stop the person wearing the face covering infecting other people, because they can't project droplets for the 2 meters. So, and they need washed. So yes, undoubtedly, if people are going to run a nose and coughing and spluttering into their own face mask, then you certainly want to offer that face mask to anybody else to wear, and it would have to be either replaced or cleaned.
I actually think this question is a new one for me. I mean, that's a very good summary from you, Ian, but I think the question is actually about contamination actually from the face mask itself, and the inhalation from that, which is a new one for me. I don't know about you.
Well, I think I think it all depends on the material being used and how it's being used and for how long it's being used. But generally, I would not anticipate that there's material within face masks, which are hazardous to health. I mean, in the old days,
Yeah,
face
so
masks
the question
used to
was
use asbestos fibre.
fibers from the mask is the worry that Sally's followed up on that.
Yeah, no, I don't. I think they're very low risk.
Yeah. Okay. Here's another one before we move on to our ACAS speaker. What is your advice to an employer if an employee with no clinical risk factors and underlying medical conditions has a concern in returning to work due to COVID-related anxiety and fear without any mental health issue or current diagnosis?
Yeah. What was the question? Sorry, I've got the.
Well, I think the question in summary is someone has no clinical risk factors. There's no underlying mental health issue, so they're basically a normal person.
Yeah.
And they're concerned about going to work, and they've got COVID-related anxiety. I mean, what would you do under those circumstances?
Well, I think it's just first of all, I think it's justifiable that we all are cautious about COVID, because COVID is almost benign for 80% of the population, but for at least 5% of the population, it can be very nasty, as we know, very nasty, and it's unpredictable. That's the problem. It's unpredictable. We could say there are certain risk factors which we have mentioned, but it's unpredictable. So it's understandable that people have got anxiety about COVID, because they may have known somebody who's died because of it now, or have a family member who's been very ill with it, and so it's understandable. So I think in terms of the employer going back, I think the employer of the person going back in that category, I think they have to be treated exactly the same as everybody else, including people who have had COVID. That is strict standards of social distancing, the hygiene, the avoidance of mixing. Some of the things I alluded to about the workplace assessment. That there can be no deviation from very strict standards for all workplaces when we go back. And where it's not possible to social distancing, then there has to be consideration of providing people with PPE. So if someone's working at home and working in an isolated place, then that's very, very low risk. But just the commute to work can provide a challenge to people if they're going to go in the London Underground, for example. So my view is anxiety in its own can be an issue, but often if there's explanation, that helps them. If the workplace has been known to be well organized and good steps are in place. I've been very impressed by some of the companies I advise with how quickly they were to really create an environment at work, which I think is much safer than being in the community. So I think it's about the employer to be sensitive to anxieties in the workforce.
Yeah. Okay, thanks for that, Ewan. I mean, there's some very good comments actually. Neris Williams has given some comments back on the medical masks and the risks there. There's a question about whether there's representation of occupational medicine on SAGE, and the answer is not. We've got Andrew Curran, Professor Andrew Curran, who's I suppose the closest we're going to get, and we have had a meeting with HSE, which the minutes are now publicly available, which we're sending out to members tomorrow. So we're talking to him particularly around kind of video reporting. But I think it's fair to say we're very disappointed with how the government's dealt with occupational health. They haven't, for example, done the risk stratification work that we have here, and in our best efforts to inform them. We'll see if there's a response. Certainly, I got a response from Chris Whittier's office yesterday that they've received those tables. Someone said about BAME issues, black and minority ethnic issues in terms of stratification. Absolutely, that's a real issue and that needs to be addressed throughout these risk stratification. That hasn't happened, obviously, to the extent we want, but I think that's probably data rather than not wishing to. I think we might leave it at that. I mean, I might now move to introducing Susan Rafferty, but thank you to you, and fantastic presentation, and hopefully you'll pick up some questions at the end. Very on time as well, well done. So Susan Rafferty is going to talk about returning to work, good practice guidance from ACAS, and we're very pleased that ACAS signed on to this toolkit, and I think their comments were very pertinent in terms of preventing workplace problems through good communications and partnership. So over to you, Susan. Hopefully everyone can hear you.
Hello. And people can see me. Apologies. It looks as though I'm in the black hole of Calcutta. It's actually just that I have got a big window in front of me, so it's a bit of an odd situation. Thank you very much for asking me to come and speak to you. What we've certainly seen ACAS is, in the last few months, significant strains on the personal, professional, business resilience of organisations. We, as you know, I'm sure, get contacted by employers and employees. We have had unprecedented levels of calls to our helpline over a whole range of issues. What we're starting to see now, as we're starting to move towards return to work, is a lot of concerns from employees. Interestingly, some of the things raised in your chat around the anxiety about returning to work, whether that's the physical workplace or remaining at home but working, and a lot of the work that we are trying to encourage is looking at the way we can deal with building trust and engagement with employees and employers going through what is still going to be a very difficult time. So what I'm going to look at today is talking about employees returning to the physical workplace, and that will include employees who are furloughed, employees who are working from home. I'm going to touch on discrimination. We are concerned about effectively the law of unintended consequences in relation to discrimination, and also how you manage staff, and I'm also going to touch on communication. So next slide, please. Thank you. Furlough. I did these notes and slides towards the beginning of the week, and had a concern that I might have to rip up my slide around furlough, but it is continuing. But obviously for a lot of organisations, it's looking at how furlough starts to be ended. We know that we've got a longer period of time up till October, but obviously there are going to be changes to it. And the most important thing to think about when you're talking to your employees about getting them back into work is communicating with them. Hopefully everyone has a written agreement of some sort. I know guidance changed about the furlough agreement with their employees. And hopefully there is something in that about how you communicate. But I appreciate for some employers, once they furloughed their staff, they have had other pressing things on their minds, and then maybe haven't been communicating with their staff so much. Think about how you are going to serve them with notice to come back. Now, certainly I've spoken to some employers who've said, well, they're my employees, and so if I say at 5 o'clock on a Friday, I want them back at 9 o'clock on a Monday, they've got to do it. The difficulty, of course, is it may not be as straightforward for a lot of employees to be able to do that. And again, communicating with them. Think about phased returns. Again, I've certainly spoken to some employers who in their initial furlough agreement had dates that they set out that tranches of employees were going to come back. Now, it may not be possible to do that with hindsight, but again, just thinking about your furloughed employees and communicating with them is going to be incredibly important, because you've got a whole raft of people who may not have been in work for several months, and somebody mentioned in the chat about the anxieties of coming back to work. They may have serious concerns about that. Next slide, please. Thank you. So employees returning to the physical workplace, whether furloughed or non-furloughed, how do you do it? And I say communication is absolute key, and this is one thing I'm going to mention probably on every slide. Think about something along the lines of an induction. You may have staff who, as I say, have not been in work for months, And it might be that they have concerns. You may be changing things going forward, shift patterns, hours of work. I do know organisations that have decided they are going to do inductions as before they take people back in. But of course, how do you do that? Normal inductions in the normal world, you'd have had the person in on the first day, nice tour around the factory or the workplace, introduce them to people. How are you going to do that with your people who are at home at the moment? Think about that. Think about what you're going to tell them. How are you going to reassure them that you've put all your plans into place? Have you shared your plans with them in advance and explained to them what the social distancing measures are going to be, what PPE is going to be? Have your line managers spoken to their staff before they come back in? We've heard a lot about public transport, and think about staggering times. People are going to be scared about using public transport. Now, of course, for huge rafts of the workforce, they have no choice. But for those people who aren't or are going to avoid using public transport, can you stagger their start and finish times? It was interesting, Ewan's slide about what the world looked like in 2020, in February 2020, with we all started at 9 and finished at 5. And I know for years people have been talking about how can we change the world of work. Some of this may be ways of looking at it. There's the fears of public transport, and of course the fears of close contact for employees as well, as I say, hence the reason for sharing your plans with them and the decisions that you've already made. People mentioned on the chat quite a lot about vulnerable and shielded employees. And yes, this is a real concern for an awful lot of people. If they are vulnerable and shielded, should they be coming into work? Should they be remaining at home? Should they be doing any sort of work at all? Again, I can't give you answers to any of those things because it very much depends on your workplace and having the conversation. Also bear in mind that you may have staff that, even though they are not vulnerable or shielded, are sharing a household with people who are vulnerable or shielded. And how is that going to impact on their concerns about returning into work? Think about their continuing caring responsibilities. There may be a disconnect between employees being able to go back to work and their children being able to go back to school. I mentioned about furlough people. What if you suddenly find that half your workforce say, I can't come back to work because I've got caring responsibilities, I'm homeschooling, I have no childcare in support. And of course, that may also carry over to caring for vulnerable adults as well. And of course, you've got the employees who actually want to continue home working. They found that they actually really like it and are saying to you, well, I can work perfectly adequately from home. Why do you need me back in the physical workplace? Next slide, please. So what about the ones who are continuing to work from home? As we know, there is a slight difference in advice between the UK government and the Welsh Assembly, but the message still is that if employees can work from home, they should continue to work from home. So who decides? Who stays at home? Who comes into the workplace? Again, so much of this is around communication, consultation, and having those discussions with your workers. I've mentioned about flexible working. The flexible working is the employee's right to request flexible working. It is not the employee's right to be given flexible working. However, as an employer, you want well-motivated, well-engaged, trusting staff. If I have been working very competently at home for the last 3 months, maybe with additional pressures of childcare at home, a partner at home, a vulnerable adult at home, and I have been working well and productively, then from an employer's point of view, it's going to be quite difficult to say to me, sorry, we want you back in work, because my argument's going to be, well, look how well I function from home. And as I say, whilst legally I cannot demand to work from home, you need to be thinking about it from the point of view of your employment relations. Of course, the reverse is true as well. You may have employees who actually want to come into work. Everybody doesn't have a nice set up office. There have been people sitting on sofas, people sitting at dining tables, sharing the kitchen work surface with their couple of kids. And they may turn around and say, well, actually, my contract says I am entitled to work in the premises. So it is thinking about things like that as well. There was mention earlier about risk assessments for employees coming back into the workplace. Well, an awful lot of employers didn't risk assess when they sent their workers home, completely understandably. But there may be situations where employees say, this is a safe environment for me. I was happy to do it for a few months as an emergency, but now I want to come back into the workplace. Also, again, think about your ongoing caring responsibilities for employees. Employees say, I need to work from home because I have to care for people. And also bear in mind there may be other personal issues which may impact on people not wanting to stay at home. We've seen quite a lot of research showing that incidents of domestic violence have increased quite considerably during lockdown. And also there are huge concerns around people's mental health, as Ewan mentioned. Keeping people at home may seem like the right thing to do, and I'm certainly not suggesting you drag everyone back in, but be aware that for some people they may be more eager to return to work for different personal issues. Next slide, please. So changing their terms and conditions. For an awful lot of employees, the new workplace will be a very different place. Some of you may well have contracts that specify that you can change employees' terms and conditions of employment. You have the right to vary them. But a lot of people don't have those. You need to be consulting. If you have recognised trade unions, consult with the recognised trade unions under your collective agreements. Even if you don't have trade unions, have individual consultation with the employees. If you don't have the right to vary their terms and conditions and you simply unilaterally change it, regardless of the reason for that, then there is a potential argument by the employees that you've breached their contract. And you may be, as I say, doing it from the best of intentions, looking at changing their hours, their start and finish times, their shift patterns, but consult with them, try and seek their agreement. People, I think, seem to assume that because they've been doing that almost ad hoc, because we were in such a state of emergency, that they can continue to do that. The employment law, employment relations has not changed, which is my mantra at the moment. If you're going to amend their duties or their workloads, again, have discussions with them. Ewan mentioned a statistic around the fear of losing their jobs and redundancies. If people's duties are changed, if their workloads are decreased, that's going to be a very real concern, and there needs to be an explanation. And think about whether the changes are going to be temporary or permanent. What we find a lot is a disconnect between what the employer believes they have agreed and what the employee believes they have agreed. And it's not because anyone has done anything wrong, but the employer may well consider that a change is permanent. The employee considers that it's temporary. It needs spelling out and making sure that if it is a temporary change, that it gets reviewed when it's supposed to be. And this very much comes down to line management responsibilities. Are they reviewing it? Are they discussing it? Have situations changed? Has that been communicated to their staff? Next slide, please. Thank you. I mentioned discrimination and the law of unintended consequences, and we are starting to see this a lot. I certainly spoke to a couple of employers when the furlough first started who said, well, we're going to furlough all our older workers. They had quite a lot of 70-plus-year-old workers. We're going to furlough all of those to look after them, furlough them, which you could understand. They were trying to protect the people who were more vulnerable. But of course, the law doesn't really look at whether you're doing this from the best of intentions. And the danger is going forward that employers decide to keep their older workers at home, for example, and bring their younger workers into work. At which point their younger workers may well say, well, that's discriminating against me because you are putting me in a more vulnerable position than the older workers. Again, it's having the discussions with people, understanding their concerns. Pregnant workers, again, this has already been touched on. They need to have specific risk assessments. This is nothing to do with COVID. They are entitled to risk assessments. How do you help them? And of course, workers with disabilities, think about the fact that they're entitled to reasonable adjustments. Have they got reasonable adjustments at home? I mentioned earlier, you need to be risk assessing if they're staying at home. Is it actually better for them in work? Also think about indirect discrimination. Are you putting requirements in place that seem on the surface to be absolutely fine, but which are going to have a disproportionate impact on a particular group? I'm thinking in particular around people who may suffer detriment as a result of their caring responsibilities. As most of us know in this country, the vast majority of people who carry out caring for children and adults are women, and I've certainly seen some statistics that say that women are taking on more of the burden of homeschooling. So think about how your decisions may impact on those groups. Again, think about your disabled workers. Can they actually get into work without using public transport? Because it may be that they're unable to drive due to their disabilities. We're also quite concerned that there's going to be a rise in harassment in the workplace. A lot of your employees will be working from home. They're getting up, they're putting their casual clothes on. They don't feel like the formal workplace. And the danger with that is they forget about the formal rules around things like harassment, bullying, your social media policies. Do they understand what is and is not acceptable to post online, to post on social websites, to post on the internet? Of course, they wouldn't make racist, sexist comments in the middle of the workplace, but as I say, do they forget about that now they're sitting at home? I certainly know that we have seen instances of, for example, people from East Asian backgrounds being subjected to harassment online because of COVID and because of the allegations about it coming from China. So you need to be aware of that, and your staff need to understand that it doesn't matter whether they are sending the message from their mobile phone in the comfort of their bedroom or whether they are in the workplace, that it's unacceptable behaviour. Next slide, please. And finally, thinking from your manager's point of view, I know that an awful lot of people I'm speaking to at the moment are HR professionals who will understand, will eat and sleep this. But do your managers understand it? How are your managers continuing to manage remotely? Are they aware of how to manage performance, behaviours? You will have some managers who have always been reluctant to deal with conflict, to deal with issues that arise. And of course, at the moment, it's so much easier to ignore those, to just duck their heads down because everything is so remote. How do your employees raise concerns if they're not in work? I'm sure most of you have beautiful, shiny, all singing, all dancing discipline and grievance policies. But we would always advise, ACAS code of practice, that people deal with employees, try and resolve their grievances informally. And if we're all in a physical workplace, that's reasonably straightforward. My manager pops along, has a quick chat, it gets sorted out. It's going to be more difficult where you've still got remote workers. How do you do that? We've had to publish guidance around how remote workers can be managed in discipline and grievance situations. Bear in mind as well that if an employee raises a formal grievance, they have a right to be accompanied, trade union rep, workplace colleague. Think about how you deal with those issues if they are remote. Do you do it as a Zoom call, for example, with all the issues that arise, or do you put the grievance back, which again may cause problems? And think about how your managers manage conflict. Furlough against non-furlough. The grass is always greener on the other side. Furlough workers are sitting at home saying, I'm only getting 80% of my pay. Non-furlough workers are in work saying, they're sitting at home in the garden doing nothing. That is going to be an issue going forward. And home workers against present workers, workers in the physical workplace. Again, think about that. One slightly more cheerful note for managers to think about is recruitment, how they're going to manage that in the new world, how they're going to do things like induction, again, how they convince people around things like social distancing and safety if they're going to interview them, if they are going to induct them. Next slide, please. And really, this is coming back to what I've said all the way through. Consultation is absolute key, even if there's no legal requirement because you have rights in the contracts to change them, even if you are doing things from the best of intentions. We know how easily rumours, Chinese whispers can spread, so bear that in mind, and please consult with individuals and your trade unions and your employee representatives if you've got them. Line managers at the forefront of this, explaining how decisions are reached, being open and transparent, and also listening and addressing issues and concerns. I think one of the things on the chat was around people being concerned about COVID anxiety, as it were. Now, managers may be not so sympathetic about it because it might be that they know you've done everything right, but they need to use those empathetic skills to be able to understand that. And really very much a theme that, again, you have mentioned a lot in this, is that flexibility is very much the key.
I'm going to have to step in and say you've got one more minute, I'm afraid. Really,
it's all right. I have Nick, I've finished. That was perfect.
Oh no.
This is just our sources of help. So no, that's where I've finished.
Absolutely brilliant. I mean, I love ACAS. I think I've certainly used that telephone line. It's been incredibly helpful. So some chat questions. Where's good resources for domestic violence? And someone's put up a link to the government site, but it's also business and community. You've got some great resources. Someone's talked about home working and the stress to do with that, and ACPOE, the CSP, Chartered Society of Physiotherapists, Occupational Health Group's got some great resources. Just one final quick question for you in terms of kind of ACAS's temperature check. This is from Rickard Moen. How are things at the moment? Do you feel that employers are going to get people back to work in a responsible way, or are you fearful of the worst?
It's interesting. I suppose most employers who contact us, I think, are genuinely concerned about what to do, and probably are the more responsible ones by their very nature of the fact they have actually contacted us. I think so much of it is just a worry about what is the right thing to do. And we're finding a lot of employers who seem to be reluctant to actually talk to the employees, whether it's because the employee is at home or they've got a mental health condition or they're not very well. There's that reluctance to speak to their employees. So at the moment, very much what we're feeling is people are just asking for advice and feeling their way. It's too early, I think, to tell whether they are going to follow all the right processes and procedures. I think that's going to be the next month to see.
Brilliant. Thanks very much. That's a great presentation and fantastic. Lots of good feedback on the chat on your presentation. Thanks so much. Okay, I'm going to hand over to Rachel Suff, who's Senior Policy Advisor at CIPD, and it's fantastic to get the HR perspective, and CIPD along with ACAS have been brilliant partners on this project. So over to you, Rachel.
Thanks, Nick, and thanks to the previous speakers. Thoroughly enjoyed your presentations and I learned a lot. We're really pleased to be part of this initiative. Can I have the first slide? So we know that all professionals, including HR, have been under enormous pressure since the start of this pandemic to work out those stringent public health requirements and what they mean in practice in the organisation. And that will have been challenging enough. But as we move into the next phase, I think it's already clear from the presentations today that it's going to be an even more complex and challenging phase. And I use the term return to work hesitantly because it is being used to describe the next phase as restrictions ease. But of course, many have continued to work during this pandemic, whether in a physical workplace or at home. And also, we're still very much living with COVID-19 and the ongoing risk to our health in the workplace. Nothing's changed in that respect. And we do have government guidance now, but what it doesn't do, what it can't fully do really, is help employers navigate some of the really difficult people issues that will arise. And Susan has already done a brilliant job of highlighting a lot of those. So I'm sure I'm going to echo some of what Susan said. Now, at the CIPD, we have been really quick to come out quite strongly and frame any return to work in terms of employers needing to satisfy 3 key tests. Thank you. First of all, is it essential? If people can continue to work from home, of course they must continue to do so. Even the government guidance spells that out. And then if they can't work from home, if it just isn't possible, is their work deemed essential enough in that organisation for the business to call them back? Are there other options that could be looked at? For example, we've just now had the announcement that the job retention scheme will carry on until the end of October. That gives organisations very important breathing space to think about how strong their health and safety and occupational health measures are. So that is really valuable time to consider the options. And then secondly, is it safe? I mean, of course, this has to be the primary concern. All of the research we've carried out of the HR profession since the pandemic started shows that HR professionals' concern for people's health and safety is paramount, and it comes out time and time again. It's their top priority. So we do take some reassurance from that. And of course, that has to continue going forward. Ensuring a safe place to work involves a huge number of practical measures, and we've heard a lot about those today, as well as the social distancing measures, all the other flexible working approaches as well that Susan started to talk about too. We are really urging employers to take their time and have a gradual return to work. Test these health and safety measures out in practice. Some employers are carrying out a pilot with a small number of employees first before they can really guarantee a safe return for larger numbers. And as part of this consideration, it's really important as well that HR works together with their health and safety and occupational health teams as well, and facilities management. Never has there been such an urgent need to work in collaboration with other professionals in the organisation. And we think that the joint guidance that we'll be publishing that has been convened by Nick and Society of Occupational Medicine will be a really important part of giving organisations the support that they need so badly. And then thirdly, is it mutually agreed? We found at the CIPD that 4 in 10 people, we've surveyed workers as well as part of our research, 4 in 10 are anxious about returning to work. And we have really significant concerns that some people could be forced back too soon. We've already seen anecdotal evidence of that in the press. For nearly 2 months, people have been told to stay at home to save lives. And now that message is changing. In England, it's changed to stay alert. But the risk of infection hasn't changed, as we all very well know. So how do HR professionals and other professionals manage that fear that will still be there and reassure people so that they do feel safe enough to return to a workplace setting? So it's vital that there is that clear dialogue that's already been mentioned between employers and every single individual as part of that reinduction process back into the workplace. We've already heard about concerns around public transport. We've seen stories and pictures about people being crammed together already on buses. In the Prime Minister's speech and in his guidance, he made clear that please don't travel on public transport, and yet of course a lot of people rely on public transport and don't have a car or a bike. So all these individual concerns and needs need to be taken into account. So it needs to be a holistic discussion around whether it's appropriate and safe for somebody to work from a physical work environment. Next slide, please. So paying attention to all of these issues, and I've only touched on a few of them. Of course, it's a huge logistical and consultation exercise for organisations, which HR will be heavily involved in. As part of that exercise, there is going to be an employment relations challenge for many organisations like never before. It will be at an organisational level and also at an individual level as well, because people's expectations around what they can expect from work will have undergone a radical change in a lot of cases. Next slide. So, for a start, the workplace will look and feel very different. If you just look at these images, I've got two on the left-hand side, nothing special, just two typical scenarios of people working together in different environments before the pandemic. And immediately what jumps out at you is how close those individuals are. And on the right-hand side, we've got some typical new physical distancing settings from the government's guidance that it published this week. These are workplaces designed for physical distancing. So we have 2 meters marked around desks, we have plastic plexi screens, we have communal areas cordoned off, taped off. Immediately you see that the opportunities for human and social interaction, you know, two of the big things that a lot of us look forward to at work, are greatly reduced, and that really cuts against the grain of how we interact with each other, things that we look forward to. So it's very understandable that not will everybody expect this necessarily when they return to a physical working environment. Is that what people are looking forward to? I've mentioned the research that we've been carrying out of workers before they return to a workplace and what they're expecting, how they feel about that. And some were very anxious, but actually quite a lot were very positive and can't wait to get back. And that's been highlighted already. So very different expectations, but will people necessarily be expecting what will be the new reality? So managing those expectations in terms of employment relations issues in an organisation is going to be extremely challenging, because everybody's needs and feelings and concerns need to be taken on board. At the same time, from an employment relations perspective, one of the guiding golden principles is to be fair and have consistency, which I'm sure Susan will agree with me. And that is going to be a very big undertaking to balance those needs. Next slide, please. So as part of the CIPD's guidance for returning to work, of course, the detailed technical, legal, health and safety and occupational health and risk assessment requirements are absolutely at the top of the tree and most important. But as part of that consideration, that overriding consideration, we have 5 guiding principles for good people management practice as part of managing that process as well. So first of all, know your business. The government guidance, yes, we have it now, and the detailed sector guidance as well that's been mentioned, but it only goes so far. Every employer is going to have to think about what's needed for their own organisation and the specific needs of their people in the round. That guidance has to be translated to a very detailed, specific level. And then secondly, put people first. I've already mentioned this, but everybody will need assurance that they're going to be working in a safe, but also a supportive environment as well, given that that risk of infection is ongoing. Flexibility, so important, and I mean flexible in its broadest possible sense. Yes, continuing home working wherever possible, adjusting working practices to suit individual need as much as possible, but also resourcing practices are going to have to be flexible to a level that many organisations have never really thought about so far. For example, cohorting is a term now that's quite popular around physical distancing, because teams need to be kept as small as possible, working together as much as possible. There's going to be new shift processes to navigate and consult with employees around. We've got a new guide around that on our website. So a lot of different flexible resourcing issues to think about. And then be open and be inclusive. This pandemic is having, as we know, an unequal impact across the workforce. First of all, organisations need to be very mindful of equalities law and ensure practices are non-discriminatory. Speakers have already highlighted the importance of that. And there are some groups in particular that are being disproportionately affected by exposure to the infection. This relates to personal characteristics like age, gender, health, disability, also ethnicity. But also there's a whole range of other factors that are affecting people's own individual response to the pandemic, whether they've got caring responsibilities, whether they've been furloughed or not, whether they're caring for somebody who's vulnerable, whether they're juggling school, work for children and so on. So the need to be inclusive goes way beyond the law. Every employer needs to take everybody's individual situation and needs and so on into account. And then as part of that inclusive approach and fostering that really supportive environment, return to work has to be a two-way conversation. Every employee needs to know they can raise any concerns they have, that they won't be judged for airing their concerns about returning to a physical workplace. They need to know that those concerns will be fairly considered without judgment. And also, our next speaker I know is going to talk about mental health, but we know that this pandemic is affecting people's mental health as well as their physical health. People will be feeling understandably very anxious still, so that one-to-one conversation before any physical return needs to take on board the support that people might need in that respect. And as part of that conversation, line managers need to be confident and competent to have that conversation. They will need a lot of ongoing support and advice and so on. Here is a slide showing the role of line managers. It's already been mentioned, but I don't think it can be emphasised enough. We know from research at the CIPD that there's an awful lot of expectation, and this was before the pandemic, on managers to support people's health and well-being. So we're not expecting them to be medical experts or counsellors, far from it. They need to know where the line lies and where they need to refer to more expert sources of help, like occupational health, of course, counselling and employee assistance programme. But they do need to have that really sensitive and supportive conversation, to have empathy, to listen, and to know what kind of changes and what kind of flexibility that they can offer somebody if they return to a workplace. We're really recommending changes like a phased return as part of that readjustment process, coming back to a physical working environment. So really important that HR supports line managers. And to deal with some of those increasingly complex and challenging situations that people in their team are going to be experiencing. And they will need ongoing input in some of those situations. Hopefully they can tap into that really valuable advice that occupational health can offer as well. And of course, their own health and well-being is under threat. We know that line managers, we've done a lot of research in this area, and they're often the squeezed middle. There's the demands from the business on them, and then there's the expectation around supporting people and people management policies and so on. They really are in the front line in terms of their people management role. HR really does need to support them there and give them the well-being support as well. Let's not forget HR professionals. We know from the CIPD that many are working harder than ever, trying to do the best for the organisation as well as for employees in this crisis situation. So they need to look after themselves too. So just on the next slide, which is one of my last ones, this is health and wellbeing support that we've developed within the last month to support HR members. So if you are a member of the CIPD, you can access that, and that's on our website. And then the next slide, this is just to show some of the other support that's available on our website. And a lot of this is available to non-HR, non-CIPD members as well. Some of it isn't. But if we go to the next page, this is our hub for responding to the coronavirus. It has a whole wealth of practical guides and FAQs and so on it, directed towards people managers. And you can access these for your organisation. We've taken down the membership wall for all those, so they might be helpful as well. For example, support for line managers around COVID-19. So please do visit it if you think that would be helpful. Thank you.
Thanks very much, Rachel. I see there's lots of good feedback on the chat, and I'm just checking whether we can share the chat with people afterwards, because there are some quite good resources that are coming up on that. But lots of questions about mental health and anxiety, GPs refusing to do fit notes if it's related to COVID anxiety. So we are into a segue straight on to you, Christine, in terms of mental health factors, but I'm keen to get any questions to you, Rachel, in the Q&A, so don't go away. Christine, are you there to go straight on?
I am, thank you.
Lots of slides there, so keep it at pace.
I will indeed. Good afternoon, everyone, and very warm welcome, and thank you for joining me. The final 20 minutes, I have quite a few slides, but there's a few key slides on the end, and the focus is going to be on listening and signposting. Next slide, please. I'm going to whiz through these topics to get through in 20 minutes. I'm going to talk about the risks to mental health, anxieties about returning to work, the impact home can have on work, providing support, going to dwell on the skill of listening, going to only provide 2 tips to improve your health in this time, and signposting. Next slide, please. So the risks to mental health at work, for those of you who will recognise the HSE management standards coming in here. The inadequate health and safety policies, poor communication and management practice. These are key things that come over time and time again, that people, it increases stress, increases anxiety. Limited participation in decision making or low control over one's area of work. Where people have low level of support, this will add more anxiety. Rachel mentioned inflexibility, inflexible working hours is coming out, and unclear tasks and organisational objectives. These existed before COVID, and they're even more pertinent now. Next slide, please. So working at home, some people love it, some people got the bread in the oven like myself. The risks to prolonged home working, though, do exist. So social isolation can provoke loneliness and overthinking. And that gives some people more time to reflect on the big question: What am I doing? Why am I here? What is this all about? And in the COVID situation in particular, people now are aware that life indeed is very fragile and insecure. Hashtag zoomed out, I've just invented. We're all doing these virtual interactions. They are very demanding on the brain because we can't process that non-verbal communication. We're perhaps doing other things, multitasking, and new phraseology is continuous partial attention, where you're trying to just do too many things at one time. So an alternative to this is perhaps to have voice-only calls on occasions. So next slide. So some of the reasons people get anxious, and the main reason is change. Change is very stressful, and for many it is very, very anxiety provoking. Some people manage stress and some people just change and some people don't. Some workers will have lost fellow workers perhaps to COVID and dealing with that. This is a very uncertain world we're now working in, so uncertainty will add to anxieties. There will be more demands in the workplace and there'll possibly be less resources to cope with those demands. Employees will want to know, is the business going to survive? Is it going to change? Is it going to downsize? And will I be made redundant? All these factors escalate to causing even more anxiety. Next slide, please. So when employees come into work, they bring with them the impact of their home. Not necessarily talking about it, but the sort of things people will have to be dealing with coming into work is possibly, sadly, they may well be dealing with. They may be very fearful of losing their job and their income. They may be very worried about the family who are at home, who are shielding and what's happening. They're going in and out of the household now, coming in, possibly reintroducing germs. For some people, they've had change in family dynamics. Perhaps you're not seeing friends, you're not seeing even your close, your children, perhaps you're not seeing if they're older. We are aware, and it's been raised earlier, about domestic abuse, and we are aware that there is an increase in domestic abuse, and this, for some people, going to work is a respite. It's a safe place. That, for some people, has been removed, and increasing in tension in the household is very difficult for some people. Financial strains, if it's not the person themselves who might have to be taking less work, perhaps their partner, their husband, wife has lost their job. Things that may have been going along anyway. People might be dealing with relationship breakdown, and some people in this process are still cohabiting with that person they're trying to leave, and that causes an immense amount of strain, tension and anxiety, and people bring all this stuff to the workplace. So Susan mentioned earlier communication, and communication is key. This is what people want to know. People want to know what has changed in the workplace. When I go back, what's going to be different? So what processes have changed? Is getting in through the door different? What is the clocking card still going to work? All these little nuances and details need to be communicated ahead of opening so that people don't just come and have to deal with this as they turn up to work on their first day. What are the new expectations expected of people? Will they have to, if companies have shrunk, will their roles change? Will demands change? These sorts of issues will have to be addressed with HR. So how are people dealing with shielding? How will they be managed through occupational health, hopefully, or HR, or some small companies will have neither of those resources. So the sickness absence policy may or may not have been changed, but this needs to be relayed out and communicated to the employees. HR and managers need to continue to provide accurate and honest information, communication all the time. My number here differs from you, and you had 50% of the population have Occ Health. I've got it down as 38%, but it's definitely less than half of employers will have occupational health, and even fewer, I think it's less than 9%, have even considered a mental health policy. So we're dealing with lots of companies who do not have the skills or resources or knowledge to manage this. Next slide, please. So how can you provide support? Back to communication. Communicate out what is happening and what the plans are. Be upfront about the changes. Make sure the routine and work is there and allow for work-life boundaries. Adjusting the workload for employers who are really struggling. That may have to be done through occupational health or through hopefully an empathetic, understanding manager, and using occupational health services. Next slide, thank you. So this is the sort of thing that will help. Regular communication, always communication. Discuss about loneliness, discussions about fears and anxieties, being able to find your employees, knowing where they're going to go for help. Make sure the facilities that are now in place, different changes, the support is there, the IT support is there for home workers, the support and guidance for doing different things like Zoom presentations and the like. Find out what other pressures people are facing in the workplace. And mental health education for managers is vital, sadly very lacking, and something that can be very much improved on and increased. Next slide, please. So how would you identify a vulnerable employee? Look for colleagues that you already know. Look for changes in their demeanour. Look for lack of motivation or withdrawal. The list is endless, but these are some of the key things I think to look out for to see if somebody is really struggling, really, really vulnerable. And never, never be afraid to ask the question, are you thinking of harming yourself? A lot of people don't know how to phrase this question. If you're familiar with what you might say, if you're worried someone is even suicidal, know what you're going to say and how you're going to say it, and don't wait until it's too late. So helping colleagues who are actually struggling. These are some of the things, and I will not go through this slide because I want to get to the latter ones, but they're there on the screen for you. But the key thing I want to focus on here is this phrase, it's okay to feel not okay. It's actually okay to say you feel not okay, but it's not actually wrong. It's not actually right to feel not okay. Something's wrong if you feel not okay. So something needs to be done about it. Next slide. So helping employees help themselves. Someone's coming to you and they want your advice, or what can I do, what can I say? These are the sort of things that can help. Develop a routine. Stay connected or reconnect with those most close to you, and that doesn't have to be a circle of 20 people. Most people have a circle of no more than 4 to 5 people. Stay physically healthy. Practice meditation and mindfulness. Doing other things to take your mind away from what you're worrying about. Social media can cause anxiety. Have a social media holiday and only get your information from somewhere reliable, for instance, the NHS or the Gov site. Also remember, everything is temporary. This situation is temporary and it is going to pass and it is going to change. We don't know for how long, however, but it is a temporary situation. Next slide, please. So watch out, those of you who might have not muted yourself, skills of listening in case anyone's snoring. I'm going to read this slide quite slowly because this is the crucial bit when someone comes to see you. They often want you to listen. They don't want you to give advice. They don't want you to do anything. They just simply want you to listen. And this is what you can do to listen. You suspend all judgment. You suspend all sense of wanting to interrupt that person. You suspend any desire to say, I know how you feel, I've done that, that's happened to me. And suspend your sense of wanting to formulate that question in your head that you're going to say. So just stop, just listen, do not advise, and just listen. The person who's telling a very long story, who wants to be listened to, if they're interrupted, they will usually go back to the beginning of that story because they feel you didn't hear them, you didn't listen, and they will start their story all over again. And it will take, if you're a practitioner, even longer to sit through that long story. So just sit back and listen. Next slide. So I only really have 2 tips, the most crucial ones as far as I'm concerned. regarding mental health. People worried about COVID, people worried about developing COVID. One of the key things coming out is this large abdomen, the obesity, the waist to hip ratio. So one of the things, if it is relevant to somebody and they are concerned about getting COVID and they are overweight, they can help themselves by losing some weight. That is the crucial thing. The next crucial thing, my favourite subject, is sleep. The less sleep most people get, the higher their chance of contracting the common cold. And we know that if you have at least just 1 hour's less sleep the night before you have a vaccination, for some people that's enough to reduce the efficacy of that vaccine by 50%. So sleep has a massive impact. Those are the two things that people can focus on. Next slide, please. So some people reckon they can survive on 5 hours sleep, but we know this rounded down is a figure of 0. Most people require 7 to 9 hours sleep each night. And people say, well, how can I achieve it? You can only achieve it by giving yourself the opportunity. If you don't have the opportunity, if you're not in bed before 1 o'clock, clearly you're not going to have 7 hours sleep if you have to get up at 7. So have a routine that helps you get to bed at an appropriate time. If you haven't, this is my key slide I want you to pay most attention on: get sufficient sleep. And yep, there, we've gone, that's, next slide please. So signposting, most companies may have their own EAP system or something, but these are that anyone can access OneU, Mood Zone. Anyone can who works in the NHS can access these, the two links, and at the bottom we've got the practitioner health program. So and next slide, this final slide, is the SOM have a wonderful booklet on looking after yourself actually as a practitioner. So that finishes my slides, and I think it's over to Anne now, who's going to wrap up, and I'll be here for questions. Thank you.
Thanks very much. Anne, hopefully you're unmuted. I mean, that was a great presentation, and lots of appreciation also to Rachel on the chat. Pretty much all appreciation rather than any questions. So well done, Rachel. It's great presentation, and all of you have been absolutely fantastic. I'm just wondering, I'm also just saying that the chat is going to be saved. But are you on audio, Anne? Can we hear you?
Yeah, you should be able to hear me.
Yeah.
Can you hear me?
Yeah. So
fantastic. Well, we've had some really interesting sessions this afternoon. Thank you very much. I've been trying to keep an eye on the group chat and the questions that are coming up, and some of them have been directed internally, which is fantastic to have that support. So I've just picked out a few of them, and then I've added some by amalgamating questions together. So, question from Ricard, and I think this is going to be directed to Susan Raftery. How do you think COVID has impacted upon employee relations, both in a positive way and a negative way?
Okay, thank you. It's a very good question, something I think Nick mentioned earlier. I think it's quite difficult to say at the moment. I'm a naturally optimistic person. From a positive way, I think looking at how workplaces function, I think what we've found is a lot more communication. Managers are actually starting to communicate more with their staff virtually than maybe they did in the real world. So we're hoping from a positive point of view that will help. Negatively, obviously, there is the downturn, there's the concern and the trust, but I think, as I say, there is a very real opportunity for people to talk. One of the things that I said to a lot of employers I spoke to at the beginning was, this is a great opportunity because actually this is not the employer's fault or the employee's fault, the situation we're in. So we're actually all trying to resolve things from the same angle. So, as I say, my natural optimism is saying that will help. It will remain to be seen, but as I say, it's coming back to what I think all the presentations have said. It's that communication and building that trust.
Thank you. I think a good point there is that you brought in collaboration, and it's really important that we all collaborate, whether that's HR, occupational health services, and trade unions as representatives of the employees. And it's so important that we can collaborate on all those things. Right, another question. A question for Ewan. What advice would you give to SMEs managing a return to work using an effective return to work risk assessment strategy? Is Ewan there? Ewan? He's disappeared. Okay, let's go on to another one then. A question for Rachel of the CIPD. What will be your greatest challenge as an HR professional with regard to undertaking this return to work strategy?
I think, I mean, obviously the health and safety and occupational health issues are paramount, but flowing from those, I think what I've already mentioned briefly, and that's managing the individual needs and circumstances and so on over and above the sort of legal minimum in terms of individuals, but just in terms of what they now which might have changed, whilst at the same time trying to ensure fairness and consistency across the organisation, because employment relations and HR professionals are sort of taught that as part of their golden rule. And I think that's going to be extremely challenging. And there are so many different legal and health and safety and so on laws to navigate. Actually raising that to another level, but ensuring just really fantastic good people management is going to be certainly not impossible, but very, very challenging. And I think another challenge as well is just not navigating the speed and scale, getting to grips with just changing legal guidance and the support as well, like the furlough scheme. It's all new, it's changing at speed, and that is really challenging for employment relations and HR professionals.
Thank you. Interesting answer. I can see Ewan's there now. Can you see me, Ewan?
I can, yes.
Brilliant. I'm going to put the question back to you that I raised earlier. What advice would you give to SMEs in particular, really managing an effective return to work using a risk assessment approach?
It is a challenge for SMEs, first of all, because they often don't have much infrastructure. Some SMEs are quite large organisations, but the smaller ones, they're having to take the challenge on themselves. I think there's a lot of guidance, as has been discussed today. There's a lot of guidance in terms of how to do it. For example, the guide that I talked about, which is aimed at health professionals, is not exclusively, because it's got messages in for everybody. A lot of the points made are general. So I think and it encompasses much of the discussions that have happened today, that remaining in close contact with employees is always critical. The regular communication, understanding their concerns. You have the guidance about social distancing and reorganization of work, and everybody and people. I found it that SMEs that I advise have been pretty agile in that regard. So there's a lot of guidance around. So I think it's to seek help if you need it. Seek help from there are plenty of sources which are you don't have to employ. Seek help and advice. Undertake the risk assessment, and there's risk assessment documents around, and within the guide, the guide I've talked about, you can assess your risk yourself, and you can also assess their risk. And yesterday, a PHE produced a useful guide really for employers about the employer can help to make a risk assessment with the employee in terms of any health issues that they've had and return to work. So that's also just been published yesterday. So I think SMEs need assistance. I think there should be availability of the kind of advice we've talked today for all. We need, instead of this 38% or 50% access to advice, it needs to be universal access to advice for people returning to work. And I think the COVID is precipitating that kind of demand. But the agencies have been talking already today about advice. The risk assessment, SOM documentation includes some of that, and you can use that yourself. They're not exclusively for a medical group, and the websites are full of advice, and that's a bit of a problem. There's so much advice. So, and another thing is ask colleagues in other SMEs, because often across networks of small organisations there's a lot of mutual learning. I hope that's partly answered that very good question.
That's great, Ewan, and I'm really sorry, but I'm going to give you another one while I've got you. And I know this is something close to your heart, and both you and Christine mentioned it, about the very low numbers of people who have got access to occupational health advice. How would you try and remedy that? What's your recommendation? Well,
that's on the agenda, as it always has been, because it means that the interface between health and work is complex, and primarily treatment specialties don't really understand workplaces, whereas OH people spend their life going in and out of workplaces. So there are some models. There's one we developed in Scotland called the Healthy Working Lives Strategy, whereby we created a centre, regional advisors, and a website, and a universal access telephone helpline, so that anyone could phone into the Healthy Working Lives network with any problem to do with health and work, and also safety, and also return to work. So that's a service that exists in Scotland and has done for quite a long time. I think there are other various websites. We do need more people interested in this area of work. That's quite hard to get, and it's quite hard to get and build up the numbers to train. But we are actually on the case, and I chair the UK Academic Forum for Health and Work, and we've produced a value report for occupational health research last June, which was launched at the House of Lords, and that has had a very good impact on policymakers in terms of understanding the costs around poor occupational health. By that I mean not keeping people safe and secure and functioning well. And the actual costs of work-related health problems, and this is not my research, and it's been published and it's accepted. The costs of work-related, preventable work-related disease and disability and issues, in fact, amount to 4% of GDP in most countries. So it's a long haul. There are sources available. We need to think of different models, such as the Scottish model, which at least provides some access to advice. And many of us are working on it, but I don't have a magic wand. Or else I'd have bored me by now.
Thank you, Ewan. That's really helpful. Right, one last question. And this has come from Dr. Richard Moen, and it's put to everybody because I'm actually going to focus it on one person because of the microphone issues. So I'm going to focus it to Rachel. And the question is, are you aware of many employers conducting employee surveys on well-being as a result of COVID, and their feedback on how the company has handled it and looked after it? Richard had conducted one, and it was immensely useful and informative. So over to Rachel, please.
Yes, but I mean, we haven't got a complete picture. We have got some survey findings that perhaps if you have my email, I could get in touch with you afterwards. But yes, we did ask employers in our survey, one of our surveys, have you been prioritising support for people's health and wellbeing? And a majority have, and we asked them, how have you been finding out how they are and what their mental health is like? Various approaches, including carrying out employee engagement and other type surveys like that. And some definitely have been, which is good, not across the board, but importantly, what are they doing as a result of carrying out that kind of exercise? Around half have increased support for line managers. Actually just under half have, so not really doing enough to bridge that gap in terms of the importance that we've talked about today in making sure line managers can have those sensitive conversations and so on, and signpost and pick up on people if they're not feeling very well and so on. So it's quite mixed, I would say, in terms of the research we've done so far, but I can share more with you.
Well, I know if you you can liaise with Ricard through Nick. So that's basically wrapped up all the questions, because now
I'm going to just come in and to just hand over to Helen Ann, but thanks very much for handling
I was going to say.
The Q&A. Well done. Really, really good Q&A session there. So thanks to you, Anne, Ewan, Susan, Rachel, Christine. Thanks to Bevan Commission too. Just in terms of timelines for next few days, we're going to finalise the toolkits, and they'll be launched on Monday, so they're just being designed up so they're very clear. If you're a SOM member, there's a repeat, and in fact Ewan's going to be back on Monday, but also we're going to have other colleagues from business in the community, for example, and Mind on Monday from 10 till 12. So there's another webinar for SOM members only. The toolkit, as I said, will be publicly available on our website for free on Monday too. And we're also looking to do some sort of bite-sized kind of infographic chunks of this, because clearly some of these documents are quite complex and they're professional focused, but some simple things for employers I think would be useful too. Do stay in touch, do join the SOM if you're not already. It's great to have you as a member and be on the inside helping us with all these issues. Some of these issues are complicated. I can see on the chat function, you know, people who've got vulnerable shielded students, you know, how they can do their placements. You know, these are specific issues that where occupational health can help. We can't provide all the answers, but I think we're doing better than the government actually on some of this, as much as we support the government and what they're doing, very much the line we should take actually. I think that's it. I'll hand over to Helen for any final comments, and thanks to the Bevan Commission for hosting. You know, we were sweating with 500 people on this, but you've done a brilliant job, so thanks very much, Helen.
So, and again, just to reiterate our thanks to everyone, to you, Nick and Som. It's been a great opportunity to work together, and we hope we'll be able to continue that. But also to all of the speakers, we've had great feedback. And I think one of the things that has struck out to me is the participants and the conversations that have been going on online. And it really, I suppose, reinforces the need for some kind of, you know, network for you to just solve some of the problems and some of the questions yourself. We've been seeing some of the solutions actually come from people in the system. So that's been fantastic. We've had such an amazing range of contributors, people signing up to this from an enormous range of small, medium, large size industries. And it appears that many of the issues are similar, and many of the solutions are, I think, are amongst yourselves. So just a big thank you to us from the Bevan Commission, and we hope to maintain some of this, some of the contact. And I suppose one of the biggest messages, I think it came through from one of the final speakers, was this issue around listening. Listen, listen, listen. So, you know, really important, massive message from here. So thank you, everyone, and good luck.
Thanks all.
Thank you.
Bye.
Thank you, Helen. Thank you, Nick.
Thanks, everyone.
Thank you.
Bye.
Thank you.
Thank you.